Good afternoon, everybody. Happy Friday. This is my video response with regard to this week's topic on the benefits case study. Jumping right into it, we are looking at the two preferred provider plans, one with a standard deductible of $250 per individual, the other one with a higher deductible of $1,500 per individual. As the supplemental reading pointed out, there are a number of external and internal factors to consider when we are developing a benefits package. We have to take a look at how the economy is doing, we have to look at the overall size of the organization, and we have to factor in the revenue per full-time employee. We also have to take into account any opposing forces such as the demand for the benefit as opposed to the cost of the benefit. When we look at benefits from the organization's point of view, we are looking at the package as a way to A, attract new hires, and B, also retain good employees. When we look at benefits from an employee's point of view, the benefits package represents how the organization values their employees and is concerned about their health and well-being. It basically boils down to where are your benefit budget dollars best spent. As to the two plans in the case study, both are PPO plans, meaning the patient can go wherever they want within the network without having to go through a gatekeeper, in this case a primary care physician. Both plans are an 80-20 split, meaning that the employer pays 80% of the premium cost while the employee pays the remaining 20%. Both plans also allow the employee to add their dependents or their family members, hence the family deductibles. Let's define a couple things first. What is a deductible? A deductible is basically money paid towards services and prescriptions before the insurance kicks in. Out-of-pocket max, on the other hand, is the total paid by the patient between the deductible and the copays. And after you've met your out-of-pocket max, the insurance pays 100%. No copay, no more deductible. With regard to the in-network and out-of-network sections concerning medications, what the chart is actually referring to is something called the formulary, which is a list of medications that the insurance will and will not pay for and the guidelines for such. The best plan for the organization is obviously the high deductible PPO because it shifts some of the costs from the insurance to the enrollee and almost monetarily punishes an enrollee for going to the doctor and using the insurance. So in that sense, it's a deterrent and a way to keep costs down for both the insurance and ultimately the employer. The copay structure is 20% of the allowable cost, but the employee loses if he or she goes out of network because the way I read this, the employee is basically agreeing to be balance billed for services and pay 100% market cost of a medication with the hope of getting some reimbursement. What does that process look like from an employee's standpoint? I would not be very happy with that. I can tell you from a doctor's office standpoint, that's a nightmare. I mean, just a nightmare. Of course, the better plan for the employee, not so much for the organization, would be the standard PPO because it states clear rates for copays, for services and prescriptions, smaller in and out-of-network deductibles, and a smaller out-of-pocket max limit. While it still shifts some of the burden onto the enrollee through deductibles and through copayments, it might drive up insurance rates because the fees are not high enough to be a deterrent. The employer would also pay more in insurance rates because the benefits kick in with less money paid out by the employee. So again, I'm going with the high deductible PPO if you're looking at it for what's best with the organization. If you're looking at it for what's best for the employee, it's a standard PPO. As to the second question, my personal experience, I know a lot of you read my statement about micromanagement a couple weeks ago. My husband quit his job because of our micromanager, and he actually found a new job. He started on the 18th. He's very happy with it, and one of the selling points was a benefit package. Basically, he got full medical, dental, and vision with the option to add me onto the insurance after 30 days. He also got a $3,000 bump up after 90 days. So he's pretty happy with that. He's now working for a company that owns a lot of hotels and bars, and he gets discounts on rooms, and if he travels, he gets discounts for family members, things like that. So for him personally, the benefits package was important because he came from a job where he really didn't have benefits. He had no type of retirement. He had this job, he has retirement. He did not have any medical. He had to pay out of pocket for medical from the private insurance market. He did have a flexible work schedule, so this new job is not as flexible. He has to work a minimum of 55 hours per week as opposed to the other job was less. But he got that back in dividends because of the benefits, which he was having to pay completely out of pocket at the old job. So hope all is well. Please enjoy this video. Please feel free to comment. I'm trying to go as fast as I can because I know the professor does not want to go through 10-minute videos. Have a great weekend, everybody.